The blonde surgeon's medical instincts kicked in when she saw someone collapse. But when Sarah started CPR, the victim whispered, "You're being tested." Who was watching her every move? It was Sarah's first day off in 3 weeks, and she was finally treating herself to a quiet morning at her favorite coffee shop. Dressed in casual jeans and a comfortable sweater, her blonde hair pulled back in a simple ponytail, she looked like any other customer enjoying a latte and catching up on reading. The corner cafe was unusually busy for a Tuesday morning, filled with the typical mix of remote workers, students, and locals getting their caffeine fix. Sarah had claimed a small table by the window, her piercing blue eyes occasionally glancing up from her book to watch the morning foot traffic outside. That's when she saw him collapse. A man in his 50s wearing a business suit suddenly clutched his chest and crumpled to the floor near the counter. The distinctive way he fell, the pale gray color of his skin, the labored breathing, every detail screamed cardiac emergency to Sarah's trained eye. Without hesitation, Sarah dropped her book and rushed to his side, her medical training overriding any thought of her day off. "Call 911!" she shouted to the barista as she knelt beside the man. "This man is having a heart attack!" But something felt wrong from the very beginning. As Sarah began her assessment, checking for pulse and breathing, she noticed the other customers' reactions weren't quite right. Instead of the typical panic and concern she'd expect in a real emergency, people seemed oddly calm, almost expectant. "Sir, can you hear me?" Sarah asked, placing her hands in position for CPR. "I'm a doctor. I'm going to help you." The man's eyes fluttered open slightly, meeting Sarah's blue gaze. His breathing was shallow, his complexion worryingly pale, but there was something in his expression that made Sarah pause. "I need to start compressions," Sarah said, positioning her hands on his chest. The moment she began CPR, the man's lips barely moved, but his whispered words were clear enough to freeze her blood. "You're being tested." Sarah's hands stopped mid-compression. Her eyes darted around the coffee shop, suddenly seeing details she had missed before. The barista hadn't actually called 911. She was holding her phone but not dialing. Two customers near the back had their phones out, but they weren't calling for help. They were recording. The realization hit her like a physical blow. "What's going on here?" Sarah demanded, her voice sharp with growing anger. She looked down at the man who was now watching her with clear, alert eyes despite his supposed cardiac distress. "Keep going, doctor," he whispered. "They're watching how you respond." Sarah's blue eyes scanned the coffee shop with new understanding. What she had initially taken for shock and confusion among the customers now looked suspiciously like choreographed behavior. Too many people were watching her with calculated interest rather than concern for the victim. "Who's watching?" Sarah asked quietly, her hand still positioned over the man's chest but no longer performing compressions. "Medical Review Board," he breathed. "Ethics evaluation. You're being considered for the chief of surgery position." Sarah's mind raced. She had interviewed for the department head position at Metropolitan General 2 weeks ago, but she thought the decision-making process was purely administrative. The idea that they would stage a fake emergency to test her response was both brilliant and deeply disturbing. But the test was far from over. "Dr. Ortiz," a voice called from behind her. Sarah turned to see Dr. Marcus Webb, the hospital's chief medical officer, emerging from what she had assumed was the cafe's back office. "Please continue with your medical assessment." "This is unethical," Sarah said, standing up and facing Dr. Webb directly. "You're staging a fake emergency to test me without my consent. This violates every principle of professional evaluation." "Does it?" Dr. Webb asked calmly. "Or does it show us exactly how you respond under pressure when you think no one is watching? When there's no hospital protocol to follow, no colleagues to impress, no administrators evaluating your performance?" Sarah looked around the coffee shop, finally understanding the full scope of what was happening. The other customers weren't random people. They were hospital staff, board members, and professional actors hired to create this elaborate scenario. You want to see who I am when I think no one's looking, Sarah said, her voice tight with controlled anger. Well, here's who I am. Sarah's response surprised everyone, including herself. Instead of walking away in outrage, Sarah knelt back down beside the fake patient. What's your real name? She asked him kindly. Tom, he replied, dropping the act entirely. Tom Harrison. I'm an actor. Well, Tom, even though you're not actually having a heart attack, you've been lying on this hard floor for several minutes pretending to be in medical distress. That can't be comfortable. Sarah helped him sit up slowly. Are you experiencing any real pain or discomfort? Tom smiled genuinely for the first time. Actually, my back is killing me from lying on this floor. Sarah turned to the barista. Could we get a chair and maybe some water for Tom? And perhaps everyone else who's been standing around pretending to be concerned customers. The professionalism and genuine care Sarah showed for the actor, even knowing the entire situation was fabricated, seemed to impress the observers more than any dramatic life-saving heroics could have. Dr. Webb approached her as Sarah helped Tom into a chair. Dr. Ortiz, we apologize for the deception, but we needed to see how you handle unexpected medical situations without the support structure of the hospital. You could have just asked me, Sarah replied, but I understand the methodology. You wanted to see if I'm still a doctor when I'm off duty, when there's no protocol to follow, when helping someone offers me no professional benefit. The conversation that followed revealed the true purpose of the test. The chief of surgery position isn't just about technical skill, doctor. Webb explained as the coffee shop returned to normal around them. It's about leadership, ethics, and genuine commitment to healing. We needed to know if Sarah Ortiz, the person, matches Sarah Ortiz, the surgeon. And what did you learn? Sarah asked, accepting a fresh latte from the apologetic barista. That you were more concerned about the comfort of an actor pretending to be in distress than you were about being deceived by your potential employers, doctor. Webb replied. That says everything we needed to know about your character. Tom, now comfortably seated and looking much less like a cardiac patient, raised his water glass in a toast. To the most polite and caring fake medical emergency I've ever participated in. 3 days later, Sarah received the call offering her the position of chief of surgery. Dr. Sarah Ortiz, the blonde surgeon with piercing blue eyes who had always believed medicine was about genuine care rather than performance, learned that sometimes the most important tests happen when we think no one is watching, and that authenticity is always the right answer, even when everything around us is fake. The fake emergency had revealed something real. Sarah's unshakable commitment to treating every person with dignity and care, regardless of circumstances. Sarah Ortiz's fake emergency test reminds us that true character is revealed not in grand gestures, but in how we treat others when we think no one is watching. Her story shows us that authenticity and genuine care always shine through, even in the most manipulated circumstances. If Dr. Sarah Ortiz's ethical test inspired you, subscribe to the Frontline Voice for more stories about character, integrity, and authentic leadership. Hit like if you believe our true selves emerge when we're tested unexpectedly. Tell us in the comments, how would you react if you discovered you were being secretly tested? Share Sarah's story with someone who needs to remember that kindness is always the right choice. Until next time, remember that the most important tests in life aren't the ones we study for. They're the ones that reveal who we really are.